The latest about those rising COVID-19 numbers. The CDC says new cases have nearly quadrupled over the past 6 weeks. You can feel it in a lot of places. This, as the agency today could greenlight COVID booster shots for children ages 5 to 11. So for more on this, ABC News medical contributor, as well as physician at Stanford Children's Health, Dr. Alok Patel joins me now. Dr. Patel, so first let's start with that hearing on Capitol Hill, the CDC meeting to discuss Pfizer's booster shots for children ages 5 through 11. If the federal agency approves it, when can we expect it to be available?
Well, Terry, it's good to be here. If this all goes through and the CDC's independent committee, who are experts in this, by the way, approves this booster shot, we could see that greenlit as early as tomorrow morning, maybe this weekend, once CDC Director Walensky says, let's go ahead and give this out to those kids age 5 to 11. But Terry, I think the important thing we have to remind people is that in this age group, only 30% of these kids have gotten their first 2 shots, and that's still the target. That's still what we should be focusing on, in addition to the booster headlines.
All right, so let's talk about the COVID cases on the rise now, quadrupling. And as I say, you can feel it. Certainly here in Washington, you can feel just the number of notices we get from the school, the number of friends, colleagues who are coming down with it. How concerning is this, and how is it similar? How is it different to previous spikes in the pandemic?
Well, Terry, to your point, it is scary. And what we're seeing right now, exactly as you said, is this widespread and cases increasing, a lot of frustrated people. And it might be a combination of the fact that people in areas that were once restricted, that were protecting themselves, are now back in the open. They don't have the same level of protection. They may not have a recent natural infection, but here's the thing about natural infections. The new Omicron variants can evade them. They have that escape immunity. BA.2121 is incredibly contagious, almost at the levels of measles, which is the most contagious virus we've ever seen. And so that alone is a cause for people to take a step back, follow the CDC's guideline, and potentially put a mask on in areas where transmission is really high. But here's a reality check. This pandemic is still around us. We're still losing hundreds of Americans a day, and we can't normalize that. And even as we switch to endemic, that doesn't mean that we're going to automatically stop losing Americans, that we're going to stop flooding hospitals or getting people sick. That just means that the virus is a little bit more, we can predict when these outbreaks are going to happen. So in addition to getting vaccines, which prevent severe illness, we still need to go back and focus on transmission, wearing a mask, getting tested, and staying away from people when you're sick. People are tired of hearing it, but it's what we have to still keep doing.
I'm taking the subway every day here, and I've started wearing a mask again, just because, as I say, you can kind of feel it, and I prefer not to get it again. So with the summer travel season just weeks away, should parents think twice, do you think, about going through with vacation plans, summer camps? How do you feel about that?
I think parents should take the necessary steps to follow the local guidelines. You know, make sure if your kids can tolerate wearing a mask on planes. Look at all the areas where there might be indoor gathering. Make sure your kids are vaccinated and or boosted depending on their age. Pay attention to your children's underlying medical conditions. And we've been saying this since the very beginning. Parents should always feel empowered to talk to an institution, a summer camp, a school, and ask them about their protective measures, about ventilation, about how seriously they're taking local cases. Terry, I think an important thing we have to keep reminding people is no public health official or physician wants to see a shutdown, wants to see kids kept out of school or these activities. All these layered protection measures are so that we can make sure that our kids are still experiencing a normal life to a protective degree. That's really important to make sure, because I keep hearing this pushback from people saying, you want to lock down again. That is not the case.
Right, there is a cartoon version of public health, which obviously has taken hold in the country, but practical, sensible protections is what we're looking for. But I want to go back to something you said earlier. And just to underline it, describe a little bit more how it's different now. This strain, I think I heard you say, is worse.
In terms of it being worse, Terry, it's because of how transmissible it is. And the fact that people may have recovered from a previous COVID-19 infection in the past and have escape immunity from BA.2121. Immunity levels are even waning to the point where some people are still getting a reinfection. Even if they previously had Omicron or got vaccinated, yes, you'll be kept out of the hospital, but you can still have long symptoms. You can still infect somebody else, which is an issue also. And I want to highlight something. You know, Ed Young wrote in The Atlantic an article about what hospitalization numbers are not describing, and that's the fact that our hospital system is still on a tipping point and still is working to the brim with burned out, exhausted staff. And just because people are not talking about, that does not mean that it exists. When people say things like, I'm not afraid of getting COVID because we have treatments, we have medical facilities, we do, but that's taking for granted a system that is running thin and where we may not have healthcare resources in every part of the country. So people have to do their part.
That is really helpful perspective, because we all feel, especially those among us who are vaccinated, well, you know, maybe we don't have to be concerned as much. The virus changes, and we have to respond to those changes. Dr. Alok Patel, as always, thank you very much for being with us.
Terry, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.